The following presentation will go over the eye condition of glaucoma, presented by Molly Hosking, occupational therapy student from Spalding University. Glaucoma is defined as a group of ocular diseases that affect the interocular pressure, abbreviated as IOP, in the eye, causing damage to the optic nerve and loss of peripheral vision, or known as side vision. Glaucoma is a progressive disease. That means it is a condition that gradually becomes worse over time. There are several different types of glaucoma. Open-angle glaucoma is a chronic condition that progresses slowly over time, usually not noticeable until the late stage, where vision is lost and IOP builds up, or interocular pressure. Normal tension glaucoma is a condition where the optic nerve is damaged, though one's IOP is in within normal range between 10 to 20 milliliters of mercury. Angle closure glaucoma is a sudden and painful vision loss progressing fast, often discomfort in the eye with pain, blurry vision, red eye, and nausea, which may lead to medical attention before permanent damage occurs. Congenital glaucoma is a rare condition found in children where the eye's drainage system is found abnormal that leads to a buildup affecting the IOP. Pigmentary glaucoma is a condition where the pigment from the iris of the eye essentially flakes off into the drainage system of the eye, creating buildup and can elevate the IOP. Exfoliation glaucoma is a condition of secondary glaucoma where an abnormal amount of protein is built up in the eye that causes blockage of the drainage system, also affecting the IOP. And lastly, uveitic glaucoma is a secondary glaucoma caused by uveitis, which is inflammation of the middle layer in the eye, called the uvea. Uveitis can cause blockage of eye drainage system with debris or scar tissue from the inflammatory effect that can elevate the IOP. We will now be going over the anatomy for glaucoma. Within the eye, there is aqueous fluid, which is produced daily that flows to the front of the eye, helping maintain the IOP, transport nutrients, light transmission, shape maintenance, and waste removal for the eye. Now, this can be found within the anterior chamber that is in front of the eye, in front of the lens. It is between the cornea and the iris, part of the ciliary body filled with aqueous fluid, as mentioned before. The ciliary body produces aqueous fluid and houses the ciliary muscle that changes the shape of the lens. In glaucoma, this system of drainage is disrupted. That causes the IOP to rise with aqueous fluid not draining properly, causing the optic nerve to be compressed or damaged. Eye care professionals can diagnose glaucoma in the following ways: using tonometry, which is also the glorified eye puff test, which measures the fluid pressure in the eye, using a dilated eye exam, a visual field test, visual acuity, pachymetry, which determines the corneal thickness within the eye, and lastly, the optical coherence tomography, which is the imaging procedure to view the optic nerve to detect damage. According to the CDC, glaucoma is prevalent in about 3 million Americans, and it's the second leading cause of blindness worldwide. Risk factors associated with glaucoma can include, but not limited to, being Black and over 40 years old, age 60 years and over, a family history of glaucoma, diabetes, and other ocular conditions of high IOP, thin cornea, and abnormal optic nerve anatomy. Glaucoma typically affects, if left uncorrected, reduction in peripheral visual fields, but central field is not affected until the end stage, which leads to total blindness. There is a need for adjustment of lighting. Some may become glare sensitive or photophobic, and often mobility deficits. Medical ways to help the effect of glaucoma and to help the eye drain The excess fluid in the anterior chamber can include taking medications of eye drops or pills, laser treatment in the eye care professional's office, or surgery. The following can be used as management for glaucoma: environmental and organizational modifications within your natural home, magnification to improve the visibility of text, a change in eyeglass prescription to maximize visual acuity and reduce the need for magnification, enhancing contrast and lighting in natural environments, support groups, utilization of adaptive equipment that will help maintain or increase independence in everyday tasks, avoiding glare with accessories like sunglasses, hats, and visors, utilizing the visual skills of tracking, scanning, and tracing, learning non-visual aids and skills depending on the severity and progression of the disease with assistance from low vision rehab, and telescopic visual field expanders to assist with mobility deficits. Visit www.kylionseye.org/low vision resources for more information regarding low vision resources for you or your loved one.